Great to have you with us, and I'm pleased to have Nick Savarese with us, the Executive Director of the Doug Flutie Jr. Foundation for Autism, and I'll introduce him in a little while after we do our COVID update. Hopefully you guys are doing okay. It was Passover, Easter, Good Friday, all that stuff. Hopefully you had a good holidays, and for those of you that didn't have holidays, hopefully you had a good week. We had some good weather, so that's pretty cool. It's nice to get some good weather. And this week looks, I think, pretty good. I haven't really looked ahead, to be honest. I was happy for yesterday. So that was a beautiful day. So, all right, let me get started. We had, and I'm hoping it slows down because, unfortunately, new viruses are 1,000 over last week and 1,800 over the week before. So clearly we're up on an upward surge still. A lot of those are younger people. I understand more than half are younger people and fewer deaths, 192 deaths versus 248 deaths last week. We can hope that the deaths will get down to zero, but I think for that to happen, the incidence has got to go down. We can't keep going up. So we've lost 16,938 people. As of April 2nd, and we've had 605,055 people who have caught the virus in Massachusetts that we know of. In the USA, we have more cases as well than last week. It doesn't seem like a lot when you look at 24,000 more than the week before. We have 30.4 million people who have COVID and 552,829 deaths across the country. And of course, the states that seem to still, I can't imagine how they can still be the highest per capita. You would think they would put some measures in place, but they are Dakotas, Rhode Island, Utah, and Tennessee. And that continues to be the case. And you can go online and check out stats. Of course, one of these stats, the rating stats are always behind because in this case, they were from March 31st when I looked at them on the weekend. So I used to be able to find them on the CDC site much easier, but it's much easier to go to a Statista site is usually where I go, or the Becker Public Health site. This is the chart from last Wednesday, and that's the report in terms of what's happening. Viruses are up by a few, mostly in the what's called vendor operated, what I normally call private provider sites. State ops went down by 1, and basically no deaths compared to less than 5 deaths last week. So altogether numbers rose by 2. So that's 3 up in the provider system, 1 down in the state operated system, which is about 1/7 of the size of the provider system. And 41 individuals have COVID. So in terms of numbers, if you were looking at percentages, the private provider percentage would be lower still because of just the sheer difference in volume people served. So one of the news that came out with the vaccine was people with dementia or other neurological conditions. And one of my colleagues, Maurice Sullivan, actually 2 of my colleagues in Ellen Taverna, both feel like that has a window for people in our community to sign up. So as far as I'm concerned, give it a shot. We're not going to announce it formally that our communities, could start getting vaccines today. But we've been encouraging people to pre-register all along. And if you want to put down other neurological condition, if that's truly what's posted, and if you put that down and attest to that and can get the vaccine this week before the world opens up in a week or 2 from now, I think that's a good thing. We're still trying. A letter went in from Senator Lovely and Representative Barber, again, to leadership and to the administration. We sent our 6th communication, or 7th, I think, to the speaker, and to the vice chair. And she's the chair of healthcare financing in the Senate. And we did that because they're on the external advisory committee for the vaccine. So we did send one more note just to them, hoping that they could just make one more attempt to get our community prioritized. But the pre-register link is here, and we really encourage people, hopefully everyone's done that. So, yeah, so I went through it pretty quickly so I can give Nick a bunch of time. I think we're all dying for this to be over. Bad choice of words. Too many people have died. But there's so much, that has come out of this, so much fortitude. We are worried as we come out of it that we'd be ready to have staff come back and folks come back into services. So there's a long way to go. And that might not be for another few months because of the vaccine distribution. So, but I wanted to invite Nick because there's so many positive things going on, even during these times that we've gone through, right? And sometimes we don't appreciate how much is going. And one of the organizations that does a lot of positives is the Doug Flutie Jr. Foundation for Autism. And they are one of the co-founders of Advocates for Autism in Massachusetts. So they're not only involved in advancing programs and projects and good thinking, but we're involved and are involved in advocacy. In fact, they are helping put together, legislative reception that's coming up for AFAM Day. And Nick Savarese is with us, the executive director. Nick has worked his whole career in our field. He's very knowledgeable. He's, had roles in a variety of organizations, and Special Olympics being one of them, but he's got a, career before that. And really pleased to have you with us, Nick. Welcome.
Thanks, Leo. Thanks for the invite, and happy to be here today.
And I'm going to drop this screen share so people can get a good shot at you and see you, and we can put them on highlight, Carrie, if we can. But yes, and so I was going to walk through a few things with you, and then you can, go into any direction you want,
Cool. Yeah.
No guardrails.
Oh, well, I could use guardrails, actually. No, and we're casual here, Leo. It seems casual, so obviously if anyone has any questions.
So, well, what I was going to say before people ask you questions, share a little bit about the mission of the foundation, and and I know most people are very aware of it, right? But you want to share a little bit, and I know the mission's I was impressed with how tight it is, compared to ours. It's clear and.
Yeah, sure. So, I mean, so obviously we're the Doug Flutie Jr. Foundation for Autism, and a lot of you probably know who we are, or at least, the story of our founders. But, as the years go on and as new people come into the community and the state and that sort of thing, not everybody knows. So the story is we were founded by Doug and Lori Flutie. Doug Flutie was a legendary quarterback at Boston College, and won the Heisman Trophy as the best quarterback in college football. Went on to a long and esteemed professional football career, and had a child with autism, Doug Jr., who is, I think he's like 28 or 29 years old right now. And so they founded the organization 23 years ago, essentially realizing, they were looking for services for their son, Dougie, at the time. And as you all, I imagine many people on this call know, 23 years ago, it was a different world as it relates to services in the autism community. And so they couldn't really find what they were looking for Dougie, right? And then they kind of thought to themselves, wow, we have a level of celebrity, we have a level of fame, and, we know people, they could pick up the phone and call the governor or whatever, and they couldn't find it. They're like, what about all these other families? Like, this is, we got to do something about this. So that was kind of the nexus and the impetus for the foundation. And really, it was really about helping families today, helping, families, simple things like, find access to a therapist, or, find the right school or whatever it was, and really providing direct financial support so these families could afford certain services or extracurricular activities or that sort of thing. And that's kind of what started it. And that's kind of what we tried to stick true to for 23 years now, is essentially just being here for families and people in need. And it's obviously grown a lot, but we're still kind of a small organization, but we just try to do the best we can to help people and families, and obviously a lot of partnering agencies throughout the state and throughout New England, a little bit of Florida, and we even do a little national work, but really our core is right here in Massachusetts.
Yeah, I mean, I've been impressed with the impact you've had, the breadth. You talk about being a small organization, but you've touched a lot of organizations and a lot of people's. I was thinking, I hate to do this to you, but to nail down a couple of accomplishments you want to pick and that you can share with people. And I know that's hard to do. It's like picking one of your children, but
Yeah, well, it depends on the day. I can pick what child I like best, actually. So, no, so I mean, I would say a couple of things. I would say one, just not necessarily an accomplishment, but really just sticking true to who we are and why we're here. And that's kind of the direct financial support we provide to families. And we do it in a number of different ways, but really from the get-go, that's what it was about. And nowadays we kind of do it in a lot of ways through our agencies that we work with. So whether it's, Autism Alliance out in Framingham or a number of the ARCs throughout our chapters throughout Massachusetts, we partner with their family support centers. And so the families that they work with that need, again, little bits of help or big bits of help, whatever it is, whether it's horseback riding lessons or therapies or art classes or just, last year during the pandemic, it was gift cards to put groceries on the table and that sort of thing. So really, I think I'm most proud of the fact that we've just stuck with these organizations, stuck with these families year after year, providing them with grants so that they can be kind of nimble. And, when they have a family come in that needs something, we've provided them with, not a huge chunk of money, but a nice pool of money so that they can say, yeah, you need that, we can do this. You want to buy your kid a bike, whatever it is, it could be a number of different things. So I would just say kind of sticking true to the notion that Doug and Lori wanted us to have is direct financial support to families. And again, that's through partner agencies. So that's another thing that I think we're really proud of is we have these long, continuous relationships with partners. Again, I think I saw Pam on this call, if I'm not mistaken, but whether it's Autism Alliance, whether it's the Northeast ARC, whether it's the ARC of Massachusetts, a number of different organizations that we've stuck with for a really long time, so that we can really work together and build partnerships and work quickly and not a lot of red tape. That's another thing where we pride ourselves on being quite quick and nimble and not having a ton of red tape. So that's kind of one thing, is just sticking with that. Oh, the other, the other way we kind of help families is, we do have our own grant fund. We have our Joey's Fund, which again is so sort of providing more direct financial support. We also merged with another organization last year, Spectrum for Hope, which is direct financial support for multiples, families of multiples. So we thought, let's come together instead of being two separate organizations. Let's merge. And so a lot of the work we've done is in that area. So I would say kind of that's the one that we're super proud of.
Well, impressive. I mean, and I was thinking, not only, it just struck me, the Operation House Call piece that you've been helping get going so we can educate, make more doctors aware, nurse practitioners, other people in healthcare, and that by having, that program just lives on, donations, and we get a little bit of money from the schools. We have a couple of schools that give us more than a little bit, thank God, because it usually costs more to open up in a school. But because you did that, we're able to leverage that and get an emergency site up on our webpage for people that were delivering crisis standards of care, to make sure they understood, like with a few videos and pictures, that people with disabilities did have quality lives, and that, don't shirk the quality in the healthcare, because they have, victims of the pandemic. So that's a great example of something that you leveraged, and we're able to do very little red tape. And I, obviously historically, I've heard from agencies all the time and families about that level of support that you give. And I think Gene Clapper said HMEA and HMEA's Autism Resource Center is appreciative of the collaboration with the Flutie Foundation. So Gene, thank you. And of course, Pam just followed up and said it as well, grateful to be able to provide recreational activities and small grants to families in need, thanks to the Flutie Foundation. And then Alice Taylor was the chair, she's not still, of Charles River Center, just dropped in oh yeah, she said, I applied for a grant when I was treated for cancer in 2013, after DDS said no to respite care dollars, and just wanted someone to meet my son at home and keep him away from me. I was radioactive, and the foundation said yes. So wow, that's pretty compelling stuff that you guys have done, and Alice, your story really hits home, because I think that's the kind of thing you just highlighted what Nick was sharing about, avoiding the red tape and being there. when you were needed, right?
Yeah, that's no. I'm happy to hear that happened. And again, that's core to Doug and Lori. They were really they just had this kind of focus on the family end of things, and so I think those are a few definite examples there. And to your point about the Operation House Call, yeah, we love supporting that program. You're teaching the doctors of tomorrow, right? How to because it's such an issue, right? How to how many times do everyone on this call your child or your who somebody with a disability or autism or what have you can't find a dentist, right?
Yep.
Or can't even find like a haircut, right? Like let alone
Right.
so
Right.
that's such an important program, and we're happy to support it and kind of continue to support you guys. The other thing I think we're proud of is we're never going to be the organization that gives away hundreds of thousands of dollars. We're just too small for that. But just sort of along the course of a year, we'll give a grant, and then you can call us a few months later and you have this small need, boom, let's try to fill that. Let's try to fill that. So it's, it's kind of being there throughout small chunks of time as well.
I was thinking about how the services weren't there. I almost forget, about that because so much is there for kids today, right? Kids and teens. But, in the adult line, and Carrie's an expert on this, who's with me every week, even now, right? There's not necessarily the mix or flexibility, right? And Carrie can correct me if I'm wrong, but I think the whole issue with going with agency with choice in the participant directed program came the model of choice for the adults with autism when 2014, and you were part of that Advocacy Flutie Foundation in terms of getting that bill passed. We're very proud to work on that. But suddenly people didn't know what they were going to provide to the adults, right, Carrie? Nick knows this, and Carrie, you know this. You're shaking your head up at that. It was like really a bizarre situation. We got something we wanted. We didn't think we'd get it that quickly, by the way, okay? And Mike Bohr was a good friend of both of ours, all of ours, was shocked too as the chair of FM. And we knew we were going to get there. We just never thought it would go that quickly. And suddenly we realized no one in government knew, like the implementation part. They were like, we're not going to have a group home situation for a lot of these folks. Yeah, maybe some of them, yes, but that would really, they were being served anyway. You know what I mean? The people that were getting into, work, employment, or day programs, they were already being served with an intellectual disability, right? Now we were talking about people without an intellectual disability. They've had a developmental disability, right? So it's what do you think, do you still, how much do you still hear? Because even though it's 2021, I sort of feel like there's still a gap, in the adult area.
Oh yeah, I mean that seems to be what we hear a lot about, right? And so we kind of focused a few years back a lot of our efforts around employment, because obviously employment, housing, those are such huge issues. And yeah, to your point, it seems like, well, we'd all prefer if there were services and finances available at all ages, 0 to the end, so to speak. But yeah, I mean, I think you're absolutely correct in that the adult services is now a critical need. And I think a lot of it is, it's hard because when I talk to families, whose kids are in school and middle school, I'll say things like, make sure they focus starting in middle school on employment, but it's so hard for a family who's dealing with today and dealing with the issues of their 12-year-old, of their 13-year-old, to think about what it's going to be like when they're 18 or 21. And so it's like, we talk a lot about, make sure in school, heck with social studies, like get into vocation, but it's just a different mindset. You can't see, what is it, the forest through the trees or whatever.
Right.
Blame any parents for this sort of thing. But yeah, it's, you hear a lot about the cliff, right? The cliff comes
Yes.
21. You have all these support systems, whether it's school, whether it's volunteer work, real work, whatever it is. And then that cliff happens at 21. And I certainly don't have a solution to it, Leo, but you're accurate in that it seems to be the biggest need for sure.
So it's one of the future things is looking at how to help people have access to more flexible supports and services, what I was going to say is it next week, right? Is the advocacy day that year? Is it this week?
It's Wednesday. Yeah,
Okay,
I think, if I'm not mistaken, it's Wednesday at 10 a.m. or 11 a.m.
Let me look.
So this is This is AFAM, Advocates for Autism of Massachusetts. It's our, Jossie's on the call, right? It's our annual day that's typically at the State House. However,
We're doing it virtually this year.
thank
Right.
you.
It's at 10 a.m. 10 a.m. And
Yeah.
you're honoring Representative Tucker and Senator, Giassi, help me out. I know who it is too. Well, I know
Santiago.
Santiago. Oh, yes. Yes. Thank you. It's 2 reps. That's why I fooled myself. It's not a rep and a senator. It's 2 reps. And Paul Tucker, just for people to know, the police reform, some police reform language, training language, because that's one of the questions that just came up from Deborah about police training. Well, in fact, police training does go on through a program called ALEC, which has gone on for some years, but now it's actually plugged into the language of the police reform bill that passed this year. And Rep. Tucker is getting recognized on the 7th because it's both, you know, at least with autism, but it includes other disabilities as well, intellectual and developmental disabilities in terms of training. So we're really pumped up about that. And I think Representative Santiago, correct me if I'm wrong, Giassi, is being honored because of his work in health equity, right?
Yeah.
And then there's a sheriff being honored, McDermott.
Yep.
No.
So,
And that was because he brought autism awareness up, you know, through the seatbelt program, right?
Seatbelts, right.
yeah, exactly. He did the, do I have one of those seatbelts right here? Hold on, give me a second. Anyways, yeah, well, I'm not going to dig through right now. Yeah.
You guys,
He's,
I think people on your team have been helping, right?
Yeah, we work with them and we help distribute it. Again, it's for, you know, if your child is nonverbal or what have you, it's something you put on your seatbelt so that a first responder who comes to a scene of an accident or something is aware that, okay, this person has a disability or autism or whatever, might not respond in the same sort of way. So it's kind of a safety thing. So McDermott kind of brought that thing out. And yeah, to your point, the police reform bill, the way it's written, if I'm not mistaken, it's not unlike the work you all are doing educating future doctors, right, through Operation House Call, because what it does is it mandates training in the academies, right? So
Right.
for police academy, you know, people who are going through the police academy will mandatorily now, or codified, you know, existing something, you know, will have to be trained in how to, you know, to work with people with disabilities, autism, that sort of thing. So yeah, it's a big deal. Glad that Tucker helped push that through. And yeah, so that's Wednesday at 10 o'clock.
Yes, yes. And the reason, I mean, I was bringing it up because you have folks involved in helping making it happen. That's why, because I know they were practicing, right? Lisa was practicing with some members, you know, around.
Well, so, you know, we don't have, you know, you all and the partner agencies on AFAM all have a lot of expertise in advocacy when we don't necessarily have a lot of advocacy expertise. We have been very successful in events and virtual events, and we have we're more of a marketing organization. So that's our way to contribute to AFAM, is to really help execute the event from a publicity standpoint and an execution standpoint on the virtual end. So we're pleased to do it. My colleague Liz Monroe has been working with your team or with AFAM, and hopefully, you know, I think it's going to be a great event.
Yeah, so it's all these ways. People don't even appreciate the ways folks collaborate, organizations collaborate and achieve value. And this is a great example of non-duplicating what we're good at, you know? And so we're really, you know, pumped up as at AFAM. And, you know, we've been, again, you get the Flutie Foundation, Mike Bohr, through, I think, the Autism Center in South Norfolk, and Gail, oh my God, Gail's going to Kastorf, who's at that point with the Autism Center at Northeast Stark. So I'm very smiling if I spaced out on Gail's name, right? I've only knew her for 30 years. But
yeah, actually Gail's at AA&E.
Now, yeah, but at the time.
Oh, okay, yeah, at the time, okay.
Yeah. Thank you for saying that though, because that was, and he came in early, you know?
Yeah.
The partner.
Yeah.
So, but that was really, you know, how folks talk through about building an organization that would be responsive, you know, to specific advocacy needs. So back to advancing stuff. I want to give people a chance to ask you any questions they might have, but what do you, when you're sitting where you sit and your team's sitting where they sit, are people pressing you now about the challenges coming to the community for the future? Is there one or two things you want to touch on? Or, I mean, I know you're in it every day and sort of, you know, you guys are up to bat. I should use a football analogy, but I went with the baseball.
It's first and 20 or something.
Yeah.
Yeah, no, I mean, it seems like we'll go football analogy. The pandemic, when we were first and 10 from the 50, now it's first and 20 from our own 20 or whatever, right?
Right.
No, I mean, so I would say even like pre-pandemic, what we were seeing a lot of is really, you know, the inequities as it relates to, you know, communities of color, linguistically, culturally, racially diverse communities in this autism space. You know, there's a lot of immigrant communities who just don't know how, necessarily don't have the competency as it relates to accessing services, accessing, you know, resources, that sort of thing. So even pre-pandemic, that was something we were beginning to focus on, and that's been exacerbated in this. And then with the pandemic, as everyone on this call probably knows, just, you know, there's pending budget stuff, there's the workforce shortages, but really just on an individual, family by family, person by person basis, the kind of regressions that have occurred. You know, I hear so much like, you know, my child was up to here, you know, with you know, doing this well, and now everything blew up, and now it's been a year, and Zoom doesn't work, and all this sort of stuff. So it's really there's so much out there, Leo. I don't even know how to pinpoint what the major.
No, I think you nailed it. I think yeah, I bet you between the diversity issue and reaching out to other communities and the pandemic regression, wow, I think, you know, I don't think about that enough. It seems like I get into this whatever day to day and I forget about that. So I would, yeah, that's very compelling, what we're going to face.
Yeah, and so I don't know. We don't know the solutions. We only know that we're here to kind of collaborate and listen and work together to find the best way out. But it's there's some, I know it's funny because the Flutie Foundation kind of had a successful year last year. I hate to say it, right? Like from a fundraising standpoint and all this. And so it's kind of, we got to take a step back and sort of say, okay, well, it's hard to differentiate. Yeah,
you feel strange. You feel strange that you're doing well when, you know, so many, but you're giving money out, you know, it's not
correct.
Like you're hoarding it, you know, thank God.
Correct.
Right?
Yeah. No, we were able to support the autism community and more last year than we had certainly in my tenure. So that felt good. And that was the right, obviously, thing to do, and the thing we want to do more of, you know. But there's a lot of, as everyone on this call knows, there's a lot of needs out there right now.
So my big, just before I ask people, I'm going to give people a few minutes for questions, but it strikes me. So I was on a call about a week ago with some folks that do hardware distribution and do training for people, and they're focused in neighborhoods that are less affluent, okay, that are struggling. And I talked to them because a board member connected me with them, because we're thinking technology and helping people that are in those circumstances. The data is terrible out there, right, Nick, in terms of how do you help people, that are not only culturally diverse, but that are economically disadvantaged, right? How do we find those people? How do we most effectively, you know, obviously through partners, that's one way, right? Who's in Lawrence, who's in Springfield, who's in Boston, you know, who's in Brockton, you know, and so that's one strategy. But then, how do you then mechanize that so you don't, you know, so you have a partnership where, you know, you're going to get to the folks you need to get to. Are they even connected to the partners, right? Because they're struggling so much. So I don't know if you're struggling with, I think for us, from a connecting with people point of view, we're trying to figure that out in real time right now, because, and maybe it'll be one or two localities at a time. But we do think just the access to the internet that they don't have. And if they do have access to the internet, they need someone in the home to help, because their son or daughter, you know, may be able to communicate. And I'm thinking even of communication devices, assistive technology, right? Not just virtual learning. So that's huge. And I don't know how people could have learned virtually if they didn't have communication capability, right? That needed AT and didn't have it at home. I don't know how that was happening, right?
Yeah, I don't think it was, you know. Now, you know, and then you look at the districts that have been, you know, closed, it's the communities you mentioned, right? So like, I live right next door to Lawrence. My kids have at least been in hybrid for a while. Lawrence has been fully closed, Now, luckily, obviously, the kids with significant needs were finally welcomed back a little earlier than everybody else. But just those disparities have just come more and more into light. And so we don't have, to your point, I'd love to continue this dialogue offline and figure out ways we can collaborate, because the only way we've been able to do it is with our partners and one-on-one. And, we do a lot of work right down the street with the School for Exceptional Studies in Lawrence, which is essentially kind of where the students with high needs, go to as part of Lawrence High School. But the only reason we're there is because, I happen to be good friends with the art teacher at the school. And so it's like, it's not a real effective way of,
Right.
It's just like I happen, but we've been able to collaborate greatly, right?
Right.
But that's not the effective way to really serve an entire community.
And find people, right? Yeah. You lucked out with that relationship. So
yeah.
I get
Well,
it. Exactly. Yeah.
But you might call a superintendent somewhere and never really get to the
Correct.
need to go,
Yeah, exactly. So
frustrating.
do people out there have any questions? I know there's a lot of chatter early. Kudos, chatter. Anybody want to have something for Nick? You can even say, hey, thank you, Nick. That's okay too. You can tell, we don't get to talk much, but you can tell we have a pretty good rapport, and that I respect Nick greatly. So it's
same to you, Leo. No, well, I appreciate you having me on today. And everyone kind of knows, you can find us. We're the Flutie Foundation. That's one thing we kind of pride ourselves on. It's just like, we answer the phone, so if anyone, you can find us online. We're pretty visible. So if anyone has any questions or wants to get more information, FlutieFoundation.org, and, you can find me and us pretty easily.
It's a quiet group. I think we covered such a terrain. So I just want to talk a little bit about, people can feel free to ask some COVID questions too. I just want to repeat about the future piece in terms of the kids that regressed. And I think maybe it's going to be, Kerry, I don't know if you can join us on this topic, if it's going to be a matter of advocacy for the kids, and how do we get to people to help them feel good about advocating. That's one of our biggest things we find, is you can have a law, or you can have regulations, but then people sometimes shy away from in their own personal situation, and they sometimes need support. And, every day, you sort of hear about another situation where you say, well, how did that happen? Why aren't they doing this for him or her? So that's something there to think about as we look ahead.
Yeah, Carrie, I don't know if you want to.
Well, I know the Mass Advocates for Children is doing a whole webinar on compensatory services.
Yeah.
So that's coming up, I think, this month, as well as a couple of other organizations. So, again, it's how do you reach those folks who, don't normally access those types of webinars, but definitely encouraging people to really look at, getting school to maybe provide more during these COVID times, because it's been really tough for kids who can't do the Zoom.
So maybe we could maybe coach family support centers and chapters to maybe pick a week and say, hey, look, it's compensatory services week, and we're going to try to touch everyone in our community this week to learn that they can get compensatory services and what that means. But as the hitch that Nick puts out very clearly is sometimes the schools aren't going to help us get to those people, unfortunately, right?
No.
Because they're not that they don't want to help. They do want to help. They want to do the best they can. Don't get me wrong. None of us here are, castigating them, but it's also, they feel like their hands are full. Are you having us do something more? Come on, be fair to us, kind of, we've heard it, it's happened before. So.
Yeah. The Federation for Children with Special Needs, they do outreach to the CPACs.
Right.
So, the parent groups out there.
So maybe we could talk to Pam and the team there and see if there's any way we can all be helpful around that. And maybe that's the roadway to reach communities. And then the other thing I was thinking is span mass for people that can afford. Obviously, the fees are all over the place. Some people, span mass is a group of private fee-for-service special ed advocates, and some of them might do adult services too, right? I don't know, but the focus is special ed, Kerry, right? And they're a great group, and we partnered with them in the Federation early in the crisis to push for developments at the schools, and you know, and we were partially successful, you know, and they're sort of the content experts, I'd say, the Federation, SPAN, MAC, of course, too, that Kerry mentioned earlier. So that might be some strategies about really highlighting. So maybe it'll get to more people, maybe a couple of articles in local newspapers and Spanish you know, Spanish language newspapers. And maybe there's a few paragraphs we can work on with them, getting them the content from the other groups.
Yeah, no. Yeah, the other thing we're doing, we just happen to, through our grant cycles, meet a number of very similar organizations that represent different communities. So for example, there's the Vietnamese Circle of Parents that kind of looks out for the Vietnamese immigrant community, autism specific, if that makes sense. And then the Boston Chinatown Neighborhood Center has a cohort within it looking out for autism disability families. And then there's a Somali group out of, I want to say like Everett, the same sort of thing. They're all very similar. It's basically a mom, right? Every one of them, a mom who raised her hand and said, you know, we got to organize, right? And so there's this woman, Michelle Jenkins of Bryce's Journey, who took responsibility for her community in Dorchester. So there's a number of these like really small mom and pop, just one woman starting a thing, you know, and we've funded all of them disparately, but we are going to, again, this call could all be part of this same thing. We want to kind of bring them together into a cohort to both kind of learn what their community's needs are, both from a, you know, just specific hardcore need, and then also from a business need. Like, is it the best way you're operating for you to have your own 501c3, you know, all this sort of stuff.
Yeah.
I'm just throwing that out there as well as
great.
We're looking to do over the next quarter or two.
No, that's
great.
That sounds great as a doorway. Yeah, totally makes sense. All right. Well, look, everybody, if no one's got a question, we're gonna, we don't have to end right at 12:45. We're gonna end at 12:40. That's all right. This is pretty cool.
Yeah, I'm sure people are happy with that. That's
Nick, it's a pleasure having you with us. It really, and people learned a lot, but also want to really welcome people to continue to get to know the Flutie Foundation and be aware of it and the help that it gives across our state. And I really appreciate it. And we'll Christine just said thank you to you. And we'll look forward to keeping in touch offline, maybe continuing that conversation as well. So
yeah, no, thank you so much for all the great work that you've done for many years, but in particular to the pandemic as it relates to advocacy, just so much, and sharing all the resources and information. It's been tremendous. And thanks, Kerry, Leo, and it pleasure to be your guest, and we'll keep it moving going forward.
Sounds good. And then this Friday, I want people to know we're going to have something on government affairs at 10:15, federal government affairs. If people want to come on with our friends at the LEND programs. And Kerry, is there any other webinar coming up this week before we say goodbye?
Well, let's see, we're not having a Leo Live on Patriots Day, which is the 19th.
Right.
And but the week after we have Jennifer Saluski and Diane Latiskis. Jennifer's from ICI, and we've been working together on a 5-year systems change grant called the MPTE, Massachusetts Transition to Partnership to Employment. And so we're going to be presenting our free curriculum that parents, CPAC chairs, anybody can access to do. Kind of the whole premise is around raising expectations. And you were talking about employment, Nick, and how, you know, really it starts a lot with parent expectation, but what should we be pushing schools to do, the parents to do, all of that sort of thing. So that's going to be highlighted. And then Kelly Challen from NESCA is going to be doing a webinar for us on transition assessment. So when do you do it? You know, how do you do it? You get when you ask for a transition assessment. So that's coming on April 29th. So
Right, and on the
good,
12th,
timely school things.
that's great. No, those are unbelievable. Thank you, Carrie. And on the 12th, I'm going to be talking with a couple of people about what's happening across the country. So just a little bit of, I haven't done that in a long time, having people share what's happening in some other states, and look forward to doing that. So, all right, but Nick, this was great. Thank you again. Everybody have a great week.
You too.
Take care.
Bye.
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 Bye.